Besides barriers and immunizations, there are additional tools used to reduce the burden of communicable diseases. These include screening, case finding, treatment, and contact treatment. Screening has the same criteria for communicable diseases as there are for non-communicable diseases, namely that the disease produces substantial death and disability, that early detection is possible and improves outcomes, there is a feasible testing strategy, and screening is acceptable in terms of harms, costs, and acceptances. Let's discuss a few examples where screening has been used to decrease the burden of infectious disease. Screening for tuberculosis and syphilis has been an effective part of the control of these infections even before they could be cured with antibiotics. Today, screening for sexually transmitted diseases, including gonorrhea and chlamydia, are a routine part of clinical care. And at college campuses, we generally promote a Get Yourself Tested month to encourage college students to get themselves tested to see if they have a sexually transmitted disease. HIV screening has long been recommended for high-risk individuals and for populations with an estimated prevalence above 1%. Today, universal screening is being discussed as a basic strategy for controlling HIV and AIDS. Screening for communicable diseases has often been linked with public health practices known as case findings. Case findings implies confidential interviews of those diagnosed with the disease and asking for their recent close physical or sexual contacts. Case finding techniques have been a key to the control of syphilis and to a large extent TB, both before and after the availability of effective treatments. With case findings, there is always the issue of how to maintain confidentiality with follow-up on sexual contact. Case findings imply that if you have an individual who tests positive and then is found to have a sexually transmitted infection, you would then also interview their partners. This may provide confidentiality issues that have to be dealt with. Another important tool for reducing the burden of communicable diseases is treatment and contact treatment. Treatment for the disease, such as antibiotics, is an important tool for decreasing the disease. And as we look to the final tool of efforts to maximize effectiveness, we'll find that if there's no treatment, there's no possible way to control the disease. Treatment for those who come in contact with the infected person is also important. And as we just discussed, confidentiality issues are a key part of that discussion.